with more than 5 years of experience and successful years in the UK, what made you come back home?
I have a social responsibility, so I feel I have to help my people, and I feel like making difference in others' lives make me feel more happier and more fulfilled.
So, Doctor, how was your transition from coming from the UK back to India?
I think the system what we follow in Nova is pretty much like a Western system. So we have like a software which has got a prospective data entry, and we have the RFID. So we used to have all this back in UK.
Are we at par with global standards?
I think we have all advancements in India. We do everything whatever other Western countries are doing at the moment. I would say I'm really proud of that.
Hello everyone, and welcome back to another episode of Fertility Tales powered by Nova IVF. I'm your host Simrat, and I'm thrilled to have you all tuning in today because we have a very special guest joining us. Today we're diving deep into the world of fertility and assisted reproductive technologies with someone who's been at the forefront of it all. She's an experienced consultant with over 15 years in obstetrics and gynecology, with training from the UK in the reproductive medicine. Please join me in welcoming Dr. Ajantha Boopathi, Fertility Consultant at Nova IVF Fertility, Chennai. Welcome to this show, Dr. Ajantha. It's a pleasure to have you with us.
Thank you, Simrat.
Let's start from your decision to come back. You've worked in one of the most prestigious places in the UK, the London's Women Clinic.
Yes.
And you've brought your experience back to Chennai, helping so many couples on their fertility journey. I think a lot of our listeners will be curious to know about your decision to come back home. So let's start with that. With more than 5 years of experience and successful years in the UK, what made you come back home and practice here?
It's very nice to be back in your own cultural background. We have strong family ties. I think that made us come back. I have a social responsibility, so I feel I have to help my people. And I feel like making difference in others' lives make me feel more happier and more fulfilled. So I grew up here. I learned my medicine here. So I feel it's my responsibility now to give it back to people here.
That's so inspiring, Doctor. That's very inspiring. It's amazing how you've taken your global experience and brought it back to benefit the couples that are there in Chennai and in India. Speaking of experience, how does the prevalence and awareness of infertility in the UK differ from what you've seen here in India? Are there any stark contrasts?
Not really. I feel there's alarming rise of infertility globally. I think the prevalence is same, and I think in developing countries, it's the incidence is getting more. About 1 in 4 women couples in developing countries, they are affected with infertility, and the WHO states that about 60 to 80 million couples are worldwide are affected with infertility. So I would say that developing countries, they need more awareness on infertility issues and also the treatment.
That's a really important distinction that you've actually
Yes.
put out there with, in terms of developed and developing countries, and that there needs to be more awareness in the
Yes.
developing countries. What about accessibility? In terms of accessibility, is it easier for patients to connect with fertility specialists here in India compared to the UK?
Definitely, yes, because in India there are a lot of private fertility clinics. So it's there are more clinics available here than compared to UK. In UK, NHS funds the fertility treatment for few couples if they have the eligibility criteria. So there is going to be a waiting list.
Oh,
So they have to go to the GP, and then the GP refers them to a nearest hospital where they could do the IVF treatment. But again, there they do have private clinics, fertility clinics. So the accessibility, I think it's available in UK also. But I feel in India there are more clinics, fertility clinics, when compared to UK.
all right. So, what aspect does awareness play in India here, in India for infertility?
I would say, I think in India, infertility is more of a social problem. I think there's a lot of stigma around it. So recently, I had a couple who visited me with the baby. They had a IVF and delivered a baby recently. So when they came to visit me recently with the baby, they just told me that for the last 8 years, they have not attended a single baby shower or a children's birthday party. It was so sad to hear that.
But why is that? Is that because they are not okay about
Yeah,
telling the fact that they have a baby
no,
from IVF?
I think they feel that they get that societal pressure when they attend that event or a function. They feel that people are asking them about it. They feel insulted and all that. So I think it's not only this couple. I've seen so many patients like that in India. They kind of they just tell that they're not comfortable. They decline invitations to the baby showers and children birthday parties. It's very sad, and I think that has to be, the society needs to change a lot, and we need to work more on that. Another part, what I feel is the awareness. When I was in the UK, like every day I used to see at least 2 or 3 women coming for fertility assessment voluntarily, just without even, once they become like 30, they just walk in. Even they might not have thought about their pregnancy yet, or their childbearing, or their relationship, but still they want to come and get the fertility assessment done, just to make their plans for the future. I think that is lacking in India. Here now, the late marriages are more common these days. All women, they want to pursue their goals and their personal aspirations. They don't come to us until they are 35 or 38. Some women, they get married very late, even 35, 38. So I think that awareness is also not there in India.
That's true. You talked about the social taboo also.
Yes.
I mean, I think what's important here is to understand that it's a couple's disease. It's not that it's a particular gender's fault or
Exactly.
a particular partner's fault in not being able to have children.
Yes.
It's that awareness that it's a couple's disease, and like it could be treated like any other diseases.
Absolutely.
Something that this medium is also trying to achieve
Exactly.
by asking
Yeah.
people to, get checked in time, get their assessment done in time, go to a fertility specialist in time, so that, because time is of the essence, like we've also
Definitely.
discussed in the previous
Definitely.
episodes, that it's a biological clock. There's no stopping that.
Yeah,
So I think
exactly.
it's best to have regular assessments. That really
Absolutely.
helps. That's really inspiring, Doctor. I mean, there are positive strides being made in terms of access in India also, and there are in terms of accessibility. I guess India is more
Definitely.
accessible.
Yes, yes.
So, Doctor, how was your transition from coming from the UK back to India? Like, I mean, how did you settle back in?
Actually, it was easy, I should say, for me. I decided to join Nova. Here, we follow all the ethical and transparent practices, so that made me to join Nova. I think the system what we follow in Nova is pretty much like a Western system. So we have like a software which has got a prospective data entry, and we have the RFID. So we used to have all this back in UK. So before joining, when I was looking to join in India, I was looking where to join. I was looking for all this, things, and I got to know that Nova is the right place to work.
And Nova follows the same SOPs and
Yes,
protocols?
yes, it does. Yeah, so it was easy for me to transition. Wasn't difficult for me.
That's great. That's great to know, Doctor.
And I've not changed my practice. I just practice the same as I was practicing there.
Yes, and it's
and we have all SOPs in place. So we follow all the standard operating procedures. So it's easy.
It's great. That's great to know. Something that I'm not sure many of our listeners, they will be curious about. How does India compare to UK in terms of advancements and success rates in the assisted reproductive technology? Are we at par with global standards?
We are doing very well, actually. Yeah. So I think we have all advancements in India. We do everything, whatever other Western countries are doing at the moment. I would say I'm really proud of that. We are doing everything, whatever we could do. And we are getting good success rates too.
Okay, so we are at par with the global standards, and we are doing definitely much better also.
Absolutely.
I think
yes.
our success rates. What determines the success rates?
There are so many factors which affect the success rates. I would say women's age is an important factor in deciding any treatment success rate. And also it depends on the type of treatment, and also the other factors of infertility, whether it's due to the male factor or due to female factor, or sometimes it could be combined as well. But I think women's age is like a very, very important factor which decides the success of fertility.
Okay. And I'm sure you've seen a lot of changes throughout your career also. Like, how would you say that the incidence of infertility has shifted in India, especially after your time in the UK? Are there any notable trends that you've observed?
Yes, I would say in the last few years after coming back, I see a lot of young women with premature ovarian failure. I think this I have seen maybe recently. So even 22-year-old, 23-year-old, they present with premature ovarian failure. And again, there is a increasing trend in male infertility too. When we see at least like 10 reports a day, some analysis reports, out of that, I would say hardly one or two will be normal. The rest of them will have some abnormality, like either a mild abnormality or like a severe abnormality, like oligoasthenotetrospermia, sometimes azoospermia as well. There's completely no sperm in the ejaculate. So I feel these two observations I've just noticed recently after coming back.
And these conditions, can they be treated with medicines, or is there a lifestyle change that's required? This the rise of infertility, is this a lifestyle or it's a phenomena? Like most people now in the age do have women suffer from PCOS,
Yes,
men are
yes, yes.
suffering from male factor.
Yes.
What do you think is the cause of the rising?
I think the environmental factors, they play a major role these days. Maybe that it's contributing to a lot of PCOS, premature ovarian failure, as well as it affects the sperm parameters too. And other major factor, what I think is a lifestyle. Sedentary lifestyle, lot of junk food culture around, and alcohol, smoking, and partying, and sleeping late nights, and I think all those things, and high obesity. I think all those factors can affect the sperm parameters, and as well as the oocyte, as with egg. So I think we need to change. I think, and we need to optimize our health, and we have to prioritize our health over other things that might help us.
That's a very valuable perspective, Doctor. I think it's a wake-up call to everybody who's trying to conceive. Sometimes there are predisposed conditions, but sometimes you have to make an effort in your lifestyle changes and choices.
Yes. I think my worry is more on the adolescent age group now, because we see a lot of premature ovarian failure and PCOS and abnormal sperm parameters in 30s and 40s now. So what about the younger age group children now? At the moment, they are in adolescents or the teenagers. When they come to their reproductive age group, I think it's going to hit them much harder.
Yeah.
So we need to be really aware of that.
It is alarming also. It is a very alarming trend with the rise of infertility.
Definitely, yes. I think it's a parental responsibility too. So we need to make sure that our children are on the right track, doing the right things, and they inculcate a lot of physical activity and healthy eating habits.
That's true. It's a big societal change, I think.
Definitely,
that
yes.
is required for this.
Yes.
Let's talk about the couples when they come to you. I imagine they have a lot of questions and concerns about this path that they are taking. What's the most common mindset or worry couples have when they are diagnosed with fertility treatments, when they have to go ahead with it?
I think the first and foremost, they sometimes it's a male factor infertility, the blame game kind of thing. So or if it's female factor infertility, it's more common. The female factor infertility sometimes, when women has a problem, and when the husband is normal, then it becomes even more. So it becomes like a blame game, like. So I feel that it has to be confidential. And what I feel is when I was in UK, it was a confidential thing. Only the couple will know about their medical condition. The family will not know much about it. But here it's become like a family problem. When the couple come for the first consultation, you always see a mother-in-law or a family, or sometimes 3-4 people come with a couple. So here it's like more like a family problem. Sometimes it gets very difficult for us to explain what the couple is going through to the whole family. So I always make sure I see the couple first, because sometimes they might have a sexual dysfunction, which we might not discuss that with the family. So we need to give them that privacy and understand what it is. And if it is simple sexual dysfunction, then they just need different kind of treatment. They don't need like IUI or IVF for that. So first we need to understand what the couple are going through, and then come to a diagnosis of infertility, whether it's a male factor or female factor, or it could be combined factor. I think that is in their mind. First, they want to make sure that they are normal. Sometimes I've seen supportive couple, like, they support each other. So that's very important.
It is.
Having a supportive partner makes a big difference to the fertility treatment. But I think that's the first thing. And the second thing is the expectation. So once they walk in, once they know what the problem is, and they just want to get pregnant immediately in the first cycle. Even if you're trying a normal ovulation, if it's a PCOS and the male parameters are okay and tubes are normal, if you're trying the ovulation induction, it's not going to work in the first attempt. It might take 2 or 3 cycles for them to conceive naturally, or they might not even conceive naturally. They might need even other further treatments. So, the expectations, they have to know, like, what kind of treatment they're going to, what is the success rate of the treatment. And, for some it works in the first time, for some they might need second or third attempt. And if they're going for IVF treatment, so they need to know what's the success rate. And, for some it just works the first attempt, some might need the second or third. So if they're going for IUI treatment, we cannot give a great success rate with IUI treatment. Success rate is around 15-20%. So they need to they need to mentally prepare themselves about the treatment, about the process and the success rates, and how they're going to start their fertility journey. That is also important, because most of the couples, both the men and both of them are working these days. So they need to, make their arrangements prior before they're starting the fertility journey. And I think the counseling plays a very important role, because it's quite stressful, the journey. So we do have counselors on site. All the fertility clinics are supposed to have a counselor. But I think apart from the counseling session, what we offer, it's also important to have a good family support for the couple. I think the couples, they should have good communication between each other. They should make time to discuss their fears and expectations. Sometimes we feel that one partner will be very silent during the consultation. Other partner will be asking questions. Other partner will be very silent. They won't even open up. We used to spend more time with them, just find out what's going on in their mind, just to get out from them.
That's true. And it's very insightful, doctor. I mean, it sounds like emotional and psychological support is very important with familial support, and also the bond between the couple, because they are the ones who are going to have the child, and who are bringing this tiny human into this world. And it's so important that they share the same values.
Exactly.
And I'm sure there must be instances where maybe some, difference of opinion comes through during these psychological sessions also. But it's important that the couple makes that decision together. What kind of support do couples really need during this journey? And should they be mindful of when they begin their fertility treatment? I guess you've also answered this question in the previous segment also, that emotional support is very important along with familial support. What else do you think in terms of support is needed for the couple to make this decision?
Before they begin the fertility treatment, I think choosing a right fertility clinic, that is very crucial. I think it's always better to look for a clinic where all the services are offered under one floor roof, and also they need to make sure that is a registered fertility clinic. And other thing is they need to set their limits and goals. They need to because some couples they need more time to even get to start the treatment. So they first want to come in for the consultation, they want to understand what's going on, and then they want to make the decision. And whereas others they've done their own research. They would have gone through the website, they've done their own research, they would have know what they want and all that. They come straight for the treatment. So there are two different categories here. So for couples who have not yet started the research, it's always better to know about what treatments are available, or when they go for the consultation, we can discuss with them the history, and then the investigations are based on history investigations. We come up with the individualized treatment plan, and then we can go through that. And again, when it comes to the fertility journey, as we discussed, the emotional part of it. So I think that they should be prepared to take up, because sometimes we see that when even IUI, first cycle of IUI fails, they get really upset. So they think that's the end of it. They won't be able to conceive. So things like that. So they need to understand that infertility treatment is not 100% all the time. So it could be some couples are lucky enough it just works the first time, but for some it might take more attempts, and for some it might not work. The self gametes might not work, so then they might have to eventually go to the third party reproduction, like using donor egg or donor sperm or even surrogacy. So I think these are the different options available to them, and it's very difficult to very difficult to predict the success rate for that couple. We can only give them a generalized success rate, but again, it just depends on multiple factors, as we discussed: women's age and the type of infertility, and other factors. Another factor is like the physical health is very important before they start the fertility journey. So in case if they're overweight, always try to optimize the weight, because you cannot just lose the weight in a month's time. So they need to work on that to lose the weight. Or in case they're smoking and taking alcohol, better to cut down on those habits, and they should try to do more physical activity. So that will all get them to a proper physical health before they start the treatment.
I think more than support, it's also the preparation.
Absolutely.
It's a mental and a physical preparation that a couple needs to actually go through to come to that mindset. I think a positive, like you said, sometimes couples do get a little bogged down because maybe it didn't happen for them for the first time.
Yes.
But I think that mental and that positive attitude mindset that they need to come with, and also financial resources. I'm not going to discount that, but that's also important.
Yes, because it's like, we do not know. For some, it just works. Some, it just takes more time. And again, they need to
be positive about it and be
about it. Yes.
Very insightful, doctor. It's clear that there's so much to consider from a preparation standpoint for couples also. But there are also so many treatments that a couple may require. What are the different types of treatment available, and how do you decide which is the best fit for each couple? Because you're getting probably a lot of people from multiple working class also. So is there a particular treatment that is fit for somebody, one couple, or what is it?
I would say one size doesn't fit all. So we have to make the treatment plan based on the couple's history, their investigations, and the previous treatment. They might have gone through treatment cycles before. So it just can vary from simpler treatments like ovulation induction, where we give some medications to develop the egg and they plan time section intercourse. Or it could be IUI, the intrauterine insemination, where we prepare the husband's sperm, or if donor sperms require, the donor sperm, and we inseminate into the uterus around the time of ovulation. Or some couples, they need IVF, where we give hormone injections to the lady for 10 days, and then we retrieve the eggs, fertilize it with the sperm, create the embryo, and then choose the best embryo for transfer. And some couples might have had multiple IVF failures with their self-gametes. Then they might need to change the gametes, either the donor egg or the donor sperm, or some couple, they might need to go for donor embryo treatment. That again depends on their history. And there are other options like surrogacy, that again for a couple where it is indicated, that option is there. So, there are different treatment options available. I think that we need to decide based on the patient's age and their duration of infertility, and also the type of infertility and the previous treatment cycles.
So, talking about these treatments, doctor, are success rates consistent across the board, or do they vary depending upon the method? And what are some factors that actually influence these success rates?
Actually, the success rates are not the same for all the treatments. IVF success rates are better when compared to the IUI success rates, or even the simpler ovulation induction treatment. So when it comes to the success rate, women's age plays a pivotal role in determining the success rate. As we all know, the ovarian aging, as the women ages over 35, the success rates of IVF also declines for women over age of 35. And again, the success rate for women over 40 is going to be lesser than compared to women between 35 to 40. So it's very important to start the fertility treatment when the woman is in around 35 or even before that, not to delay too much. Because sometimes what I see commonly here is women, they're taking so many treatments for 5 years, 7 years, 10 years before coming to us. When they come to us, their AMH is already very low. Which AMH is the ovarian reserve marker, is very low, and there are very few eggs left. So at that point, it becomes even tricky to retrieve the eggs and to create the embryos. So I know even when they come with a low AMH, we still try hard to give them a cell cycle to make them use their own genetic material. But sometimes, in case if they have tried this self gametes before and if it has not worked, then we might have to consider using a donor egg. Or if the husband's sperm count is 0, or if you've tried the surgical sperm retrieval, if you're not able to retrieve the sperms, then we might have to use the donor sperm.
All right. And that's really helpful to be able to understand these treatments. And it makes sense that so many factors are at play
Absolutely.
in these treatments. One concern that I've heard from couples is the fear of mix-up of gametes.
Absolutely, yes.
When it comes to gametes. So can you tell us a little bit about the technology at Nova IVF? What does it use to prevent such incidents? And I believe there's a RFID
Yes.
plays a key part. So
Yes.
can you tell us a little bit about this?
Definitely. So RFID is a radio frequency identification. So basically, each of the consumables used for the patients are being tagged with their ID, patient's ID. So all the dishes and the containers, the tubes which contains the sperms, they're all tagged with the IDs. So that is to prevent the mismatch happening. So there'll be double witnessing already in system. This is kind of a triple witnessing basically. So, if there is a mismatch, then it will let us know. There'll be alarm. So it will let us know. So we'll be, we can be careful.
Oh, that's interesting.
Yes.
That's
and we use that technology across all the centers in Nova.
Oh,
yes.
It's very reassuring that there are so many advanced systems in place to ensure safety and protocol.
Definitely. Yes.
Speaking of advancements, I've heard some really cutting edge technology and procedures like there's embryo glue, ovarian PRP, PGT, and can you tell me a little bit about these advancements and how they help with the success rate?
Yes. So embryo glue is like a medium that can be used before the embryo transfer. So embryo glue basically helps with the embryo implantation, and that could be helpful for women who have had implantation failures before. And ovarian PRP is for women who have had low ovarian reserve to help them to improve the reserve. Again, ovarian PRP is still an experimental stage. It's not widely used. Very few people have practiced ovarian PRP, still an experimental stage. We need a lot of data on that. And again, the LIT, lymphocyte immunization therapy, that is also considered as an experimental therapy. We cannot offer that to all the couples. Like that is offered to couples who have had multiple miscarriages, multiple implantation failures. So that has to be decided case by case. So we cannot offer that to all of them. And other advancement is a pre-implantation genetic testing of embryos. I think that's a great thing, and especially for women over 35 years, where there could be a lot of chromosomal abnormalities as the eggs age. So that would help us to detect the abnormal embryo. I can choose, for example, if we get around 6 embryos, we can do the testing of the embryos, and we can find out the normal embryo, chromosomally normal embryo, and we can transfer the best embryo. So that would decrease the time to pregnancy, and that would also decrease the risk of miscarriage, and we could ensure a healthy live birth.
Okay. They do help. I mean, all these cutting edge technologies and advancements help in success rates also, right?
Yes, absolutely. Yes.
That's interesting. It's very fascinating that each of these treatments sound like they're really pushing boundaries of what's possible in fertility care. One topic that's gaining popularity is egg freezing, social freezing, as they also call it. What's your take on it? And who should actually consider going for egg freezing and why?
I think egg freezing can be a boon for women who wants to preserve their fertility and they want to have more control over their reproductive choices. I think if a girl is around 30 years old, she's not sure about her marriage or her pregnancy, whatever, she can get a assessment done, fertility assessment done. In case if her AMH is kind of low or even normal, I think they should come forward to do the egg freezing. I would say egg freezing is better if it's done in at least early 30s rather than late 30s. Because again, over 35, the egg quality is going to be low. So, and also what I feel is the social egg freezing awareness is getting better these days. But still, I feel I'm not seeing so many women who come forward to do that. Like in UK, we used to do egg freezing every day. There will be used to be a egg freezing case. So it was so common there. It could be either a single woman coming forward to do egg freezing, or it could be a lady who's in a relationship already, but she has not decided to consider a pregnancy. So they might consider like either embryo freezing or egg freezing.
And does Nova offer
Yes,
egg
we
freezing?
do. We do offer egg freezing, but I think awareness still. Still women are hesitant to consider egg freezing. I mean, the one thing is it's just a very simple treatment, nothing to worry about. It's 10 days of hormonal injections, and egg retrieval is a safe procedure. And then we freeze the eggs. We need at least 15 to 20 mature eggs to have a good chance of live birth later. So in case sometimes even the married couples, if they want to delay their like a parenthood journey, they can even if consider the embryo freezing. They could freeze the embryos, and then they could come back after 3-4 years. I had a lady recently. She was 34. They had made plans to go to US, so they wanted to consider embryo freezing, and they want to come back after 3 years to plan the transfer. It's not like they need to come back and have the embryo or use the eggs. In case if they're able to conceive naturally, that's fine. But in case they're not able to conceive naturally, then these gametes are there for them later, to help them later. Otherwise, if they're going to come in their 40s, then they would not be in a situation to use their own eggs. So at that time, they might need donor eggs at that time. So at least it's kind of trying to save for the future. You may use it, you may not use it in the future, but at least you have a peace of mind
That
you've
option.
done the right thing, and you will know that we have some genetic material for us. So in case they're not able to conceive, if they want to delay the pregnancy, then they might choose the egg freezing option.
All right. Talking about egg freezing, doctor, these hormonal injections that the woman undertakes, are there any implications to it? Are there any side effects?
No, not really. It's basically the hormonal injections, the hormones which normally they produce in our body, we are giving it externally. So every month there'll be one egg which will be recruited in a normal menstrual cycle. In a IVF cycle, we're giving hormones externally, so we recruit more than one egg. So for example, if a woman has like 15 eggs in that particular month, or when we scan on second day, at least we're aiming to get 10 out of the 15 eggs. So that's the reason we need to give hormones every day. But actually the effect it won't last more than a day. That's the reason they need to have it every day, right? And once they have their periods, again, next month, their body is back to normal. She'll be able to recruit a normal, ovulation. She'll be normally able to recruit egg and have her ovulation. She'll not have any menstrual disturbance, or this will not cause any side effects. It's not going to remain in their body for a long time. So that's something I think many people think that, when you have hormonal injections, it will cause us a lot of side effects and all that, because it's very transient. It's only for 10 days they're going to have the injections for. And it's very friendly as well, because it's very thin needles they have. It's not like a big needle, thin needle they have.
Is it self-injectable?
You can self-inject, but I think, in India, we are more careful. So we tell the patients to come to the clinic to, take the injection. In UK, patients, they self-inject. We give the injections home.
Okay.
They keep it in the fridge and they do themselves. They could even take it to work with the cooler bag, and they get the injections done there also.
Interesting. That's really empowering for women to have that option for egg freezing. But for those who do decide to do egg freezing, how long can these eggs be frozen for? And how many ideally should be stored to give the best chance of a positive pregnancy option?
Actually, according to the ART law, we can keep the eggs frozen for 5 to 10 years.
Okay.
And even after that, if the egg freezing is done for medical indication, for example, for the onco fertility, for example, if a girl is going for a cancer treatment for chemotherapy, radiotherapy, and that, that indication, we can store even longer. So that we have to apply to the national board to get the permission. And I think when to have a best chance of live birth, we need to freeze at least 15 to 20 mature eggs to have a good chance of live birth, because later when you thaw the eggs, not all of them will survive the thawing process. So once you fertilize that with the sperm, then we need to have at least 3 to 5 good quality embryos to have a good chance of live birth. So I think egg freezing is a boon to many women who plan to do it. And again, some women who have endometriosis or with the lower ovarian reserve, they need to think about it.
Yeah. I think identification is also such a big aspect
Yes.
also, right? When you are predisposed to these conditions, maybe you can, earlier in your life, I think,
Definitely.
then you can make that kind of a choice later also about egg freezing.
Absolutely.
When you know that you are exposed to these conditions, it just, it helps to have that option available.
Yes, definitely. Yes.
It's great to have that clarity, doctor. Finally, before we wrap up, what advice would you give to couples who are just planning out their fertility journey, who are just beginning to start out, and how to best prepare themselves mentally, emotionally, and physically? Because it's a process.
Yes.
What would
yes.
your advice be to these couples?
I would say to all the couples, when they start their fertility treatment, to stay positive.
Yes.
And I think that is very, very important, to have a positive attitude. And again, they have to do little research on the clinic. We have to choose the right fertility clinic. And also sometimes it could be either your friend's suggestion, or somebody else might have had treatment elsewhere. You can take their suggestions, or just go to the reviews of the clinics available in your place. So that would help you to choose the right clinic. And also we need to check the range of services the clinic offer. That is also important. And other thing is to prepare physically. We need to make sure that the couples, they eat a healthy, balanced diet, they optimize their weight, and they have to cut down on alcohol and smoking if they have those habits. And when coming to mentally, I think first and foremost thing is the communication between the partners. I think that is very, very important. They need to give the time to each other to discuss all their fears and expectations, and they have to support of each other, and they have to avoid the blame game, and they have to get all the best support. It could be the family or friends, or it could be some couples, they keep it confidential. They don't even tell the family. That's still okay. Clinic can offer support, and all the fertility clinics, they have counselors, the fertility counselors, so they can support them throughout the fertility journey.
That's very important. An overall approach to their fertility journey. Thank you, doctor, for summing it up so beautifully.
Thank you.
Thank you for being on the show today. It was really insightful to understand all the aspects of fertility and the treatments available, and especially with regards to egg freezing also. And with that, we come to an end of another episode of Fertility Tales powered by Nova IVF. Thank you all for tuning in, and we'll be back with more insights, more stories, more support on your path to parenthood. Until then, take care, stay hopeful, and don't forget to subscribe to this channel. Remember, you're not alone in this journey to parenthood. See you next time.